Hi, everyone, and welcome to the Coffee and Counseling Podcast. Before we begin, just a brief disclaimer. This podcast is for educational and informational purposes only and does not take the place of therapy. We hope you enjoyed today's session. Hello, everyone, and welcome to today's session of Coffee and Counseling, where we don't spill the tea, but the coffee will be piping hot while we talk about all things counseling. We're your hosts, Rachel Steinhardt
and Stephanie Van Shake, and today we're going to talk about medication and its role in mental health from our perspective. Before we begin, we want to make sure it's very clear that we are not medical doctors, and this session is solely going to be based on our experience as mental health professionals, as well as collaborations with other professionals that does include sometimes prescribing practitioners. So grab your coffee and let's get into it. Rachel, do you want to start us off with one high, one low for this week?
Sure. So I just dropped off the last bit of my family that was in for the holidays in Florida. I just dropped them off at the airport today. So that was a little bit of a low, just saying bye. It's always hard. It's so funny because I always feel like my low and my high are connected. Like,
yeah.
Let's analyze that for a minute. I don't even know. But I feel like sometimes that can be, as much as my family is my whole world, and it's really, really hard for me to say goodbye to them. I always have like a pit in my stomach when I'm driving to the airport. But I think it's also healthy to, have those healthy boundaries with family and kind of getting back into the routine of like my own life with my husband and my kids and just like having my own space. Even if I don't always like it, because I'm like, Mom, move in. But I think it is definitely healthy, that it's kind of giving you that time and space to just kind of get back into your routine. I think whenever family's around or you have somebody else staying by you, even if it's someone you love till the ends of the earth, it kind of throws you off a little bit of what you're generally used to doing. And it's always healthy to kind of get back into that, because I always say routine and stability are key to success in general, but also just maintaining wellness.
Mm-hmm.
So definitely a high and a low
Yeah.
within the same, which has apparently been my thing lately. So
When I think about what my highs and lows will be, a lot of times I think about it and I find that they're interconnected. So I try to change it up. And, as you guys know, we're not always saying like our absolute highs and absolute lows of this week. Sometimes we mix it up and throw in something that might be a low or a high, but nothing. Sometimes it might be more intense and other times not. But it's certainly, when it comes to family and leaving, it does become a little bit easier with time too. But then every single time you see them, then it kind of goes right back to you missing them and all of that. But thank God for technology and thank God for air travel, because everyone is a flight or a phone call away. So I'm glad
also
they were.
about what is happening. I'm sorry to cut you off. What is happening with the airplanes today? Like, what in the heck is going on?
Yeah.
Is there, like, I feel like I'm about to like hop on a conspiracy theorist train, because it's weird. Like something is not adding up. You guys, like, what are your thoughts on this? We all went from flying for years and years and years with like a problem once in a blue moon that would like make headline news and we would talk about it till the end of eternity. And now there's like issues with airplanes
Yeah.
front, left, and center. And I don't even have a fear of flying. But what is going on, you guys? What are
Mm-hmm.
your thoughts? Please comment. Like, send us an email. Someone tell me your conspiracy theories, because I'm starting to get freaked out. I don't know about you. It's just weird. It's just a
Totally.
lot for me.
For my highs and lows, I'm like, all right, well, my low, I talked to Rachel a little bit beforehand. I've been just cranky pants today. Like, I have just been in one of those moods, and it's okay. It happens every so often. So I guess just having a little bit more of a level of irritability today, that's been a little annoying. So that would be, I would say, a low. And my high is actually finding out that McDonald's snack wraps are coming back. I single-handedly think I'm responsible for this, because I've been venting, and if our phones are listening, they've been sending this to McDonald's all along. that I've been venting for like a decade now. Like, what happened to the snack wraps? I love them, and we just got confirmation that they'll be coming back. So expect that one of my highs over the next few weeks is going to be having a snack wrap after a decade.
Oh my gosh. Okay, wait. So, Steph, for those Jews who keep kosher and can't go to McDonald's, you have to explain to me what this is because now I'm like really intrigued.
Okay, so it's so basic though, but it just is one of a kind. So a snack wrap is a flour tortilla. There's some shredded lettuce in it, and I used to work at McDonald's when these came out a long time ago, so that's why I'm very intimately
Wait a minute,
knowledgeable.
you worked at McDonald's. Why did I not know this?
Well, it was like so long ago. I was like 15 years old, and I worked for 3 years there. I actually became a manager when I was in once I turned 18. Yeah, I don't know why. I guess I don't really talk about it often, but this is why I'm intimately familiar with the the makeup of a snack wrap. And then you put it's just some shredded cheese, shredded lettuce. It started off with just being a ranch snack wrap, but they had like honey mustard and barbecue where you could pick one of your sauces and either put a crispy chicken select, it was called at the time, or chicken finger or grilled. And I always would get a honey mustard snack wrap, crispy snack wrap, and get a side of barbecue sauce and dip it in there. Oh gosh, it was so good. So you can make it yourself, Rachel, and it probably would be.
You know I'm going to, first of all.
Yes.
And second of all, I'm so happy for you. That's
It was
great.
such a good mix.
We love that for you.
So let's move into why we decided that we wanted to cover this
Ready?
topic. So I'll start off giving a little bit of reasoning why it was important to me to talk about this. Again, we're not medical doctors. However, I find that so many people that I treat, and also not even people that I treat, just in my personal life, who have the wrong idea about medication. And unfortunately, a lot of times it comes from the prescriber themselves, in the sense of there's not a lot of talk about, from the majority of people, I'm not saying everyone, but what I find is that a lot of professionals are not saying that you need to also get therapy, because the medication is a tool. It's not the be all and end all. And ultimately, for most people with most struggles that they're getting medicated for, the goal is to get off of the medication. And that's often not a part of the conversation that the prescribers, from what we're hearing, are having with the client, their clients or their patients. And also there's some issues too with who is prescribing. And I'm going to cover that a little bit later as well. Not fully, but it's something that I think is worth mentioning.
And I think you just covered so many great points, which we're going to get into in a minute. But, I think we've talked about this in episodes before where we're really finding ourselves in a generation that's constantly looking for a quick fix. And I really want to start off by saying there is absolutely a time and place for medicine. There is absolutely, especially with certain diagnoses, not only a time and place for medicine, a requirement for medicine. There are certain disorders that many mental health professionals, including Steph and I, will not even work with if you are not on a medication regimen. So we are not here to say, God forbid anyone should feel shame or bad or there's something wrong with medication. I just want to start off by saying that there's a reason it's there. People need it. It's a wonderful thing that has given people so much um, freedom in their life and health and wellness and the ability to, move on with very, very difficult circumstances and diagnoses. However, we are talking about all the different faces of medication, all the points that sometimes people don't talk about, the misuse of it. We're really just finding ourselves in a place where, and I'm sure Steph can relate, where sometimes we have clients calling us and essentially like they just want to go straight to give me a pill that's going to make me feel better immediately. Um, and not that we don't understand the temptation for that. Like, who doesn't want like an Advil to just cure their headache so they can move on with their day? I get it. But what people don't talk about enough is A, how harmful that is, and B, how much you're kind of just putting a band-aid over a much deeper and much more serious issue that you're kind of just throwing under the rug and not really dealing with, which essentially gives the opportunity for that issue to just grow as you are ignoring it. So let's get into it. I want to start off by debunking a really common myth about medication, which we kind of just touched on, which is that it is not a treatment on its own, guys. It needs to be utilized alongside therapy and an appropriate support team. So, for example, if you are struggling with an anxiety disorder, choose your flavor. There's a bunch of them. But if you're struggling with an anxiety disorder, the treatment for an anxiety disorder is not let's pop a Xanax every time we're about to lose it, right? Like that's not going to cure or even teach you how to manage your anxiety disorder. It's going to help you as you are on your journey to learn how to overcome your anxiety disorder, learn to live with your anxiety disorder, learn to manage it, understand yourself, understand your triggers. It's going to help you go through that therapeutic process. It's also going to help you when, quite frankly, and we'll talk about this later on, sometimes talk therapy is just
Mhm.
not enough. I said it. Oh, I
Mhm.
said it out loud. Yes, sometimes talk therapy alone is not enough, and we absolutely need medication alongside talk therapy at certain points to help you get to where you need to get to
Mhm.
treatment-wise. Um, but that alone is not gonna fix your problem. It's not gonna give you the results that you want, and it's going to have side effects that we are not taking into consideration. So this is really something we need to internalize, is that popping a pill is not going to fix all of our
Mhm.
problems.
Yeah, and I find that I have many clients who call me up before they become clients and ask me about my position on medication. Now, I want to be clear when we say not only are we not medical doctors, but we don't prescribe medication either. I know in some states that therapists do prescribe. In some licensures, we don't. So I think it's also important to make sure it's clear as well. But it is something
Absolutely.
that we do make recommendations for our clients when we believe that okay, something's getting in the way. We need to figure out what it is, and we're doing all the things. We're trying all the tools. We're learning different skills and different ways of thinking about things, but we still can't get through. And sometimes the missing piece is medication. So that's exactly what I would explain to any potential client who's a little hesitant because they have been told so many times that just go for this medication and that'll help. And some people are not about that. And some people are very nervous about taking medications or just don't want to take that so willy nilly, which I totally understand and I totally respect. So it's something that I would say well, it could be a recommendation, but what I normally recommend that for most issues, let's start off with talk therapy. Let's have an evaluation period to see what we can do. And sometimes this isn't always possible either. Let's say if you are having panic attacks all day, every day, you probably won't get anywhere with talk therapy because you can't even be able to sit still enough to have a clear mind to be able to work on the tools that we would work on in therapy. So that might be right off the bat. Let's get a psychiatrist or a psychiatric nurse practitioner on board to discuss what might be able to be done with that. But if it's something that you are experiencing depression and it's very hard for you to get up out of bed, but you do for the most part, and you are able to go to school or go to work, that is something that maybe we do have a little bit more wiggle room that we can work on the depressive symptoms in therapy before jumping right to medication. And maybe we find that we stunt in a certain place and nothing we're doing is helpful. Then maybe that's the point that we discuss medication and going to a proper professional to look at that and see if that would be something appropriate.
Absolutely. And, I think you just said that so well in the context of there are times where a person is not even in a mental space where they're able to accept therapeutic tools, to hear what we're saying, to utilize the skills that we're trying to teach. That would be a wonderful example where medication is very much appropriate. But that doesn't mean you take the medication and you leave. That means you take the medication and you go to therapy and you do the work, and it gives you the ability to hopefully slowly come off of it and utilize therapeutic tools. Now, that's not always possible. Some people and some diagnoses require you to be on medication for years, for months, forever. It depends. And that's okay too. that we're just trying to make you guys understand that it is complex and there are a lot of different circumstances into how medication plays a role. And it really depends on each person and their story and their diagnosis as to the role that medication is going to play and how it's going to play out. Um, so, a really other good way of kind of navigating whether or not medication might be a good, um, you know, essentially a tool to use is recognizing that your mental health is significantly impacting, negatively interfering with your daily life. And if you're sitting there and you're like, listen, I'm trying the positive self-talk, I'm trying the deep breathing, I'm trying the mantras, I'm trying, and I'm just, I'm throwing out very classic, very, common skills. There's obviously a multitude of other things that people do and use in therapy. I'm just throwing out there things that most people are familiar with. But let's say you're utilizing the things that you're talking about in therapy and you're like, I cannot stop having flashbacks. I cannot stop having panic attacks. I cannot stop crying. I can't focus. I'm just finding myself in a dark place to the point where it's scary. If you're somebody who struggles with bipolar 1 or 2, if you're someone who struggles with schizophrenia, it's very likely that medication is going to be part of your life. And at least part of your life to get you back on your feet if you're in one of those situations where it's interfering with your daily tasks, but it is a diagnosis that has the ability to be cured. And so really looking at that as with therapy and with utilizing the therapy that I'm working through outside of sessions, how is my level of functioning? And then saying, okay, do we need to look at medication as another form of treatment? And that really helps you also come to the conclusion and talking about that with your therapist, with a potential psychiatrist, nurse practitioner, whoever's prescribing, um, if this is a good decision for you, and definitely talking to somebody who's going to provide you with the appropriate information. We'll talk about that in a minute as well.
Something that is really important to get across with this entire topic isn't about giving a prescription to you as to what you should or shouldn't do. But our goal here and our goal in this podcast as well is about education, because a lot of people are not having these conversations. And some of these things that we talk about might not be things that you've heard before and might not be a perspective you've ever thought about before. And we're all about empowerment here. So we want to empower you to make an empowering decision that's right for you when it comes to medication, and know who you're supposed to talk to. How do you know if it's appropriate for you? Of course, we want to listen to doctors and professionals and their recommendations, but it's also very important. You are your own biggest advocate, that you understand why it is that you're doing something. You need to be buying into the treatment plan, whether or not that's medication that's involving medication, or it's simply therapy. Not simply, that's not the greatest way to put it, but therapy or therapeutic interventions that might be more along the line of talk therapy, utilizing different types of therapeutic modalities and tools. And I would really recommend too, when we talk about prescribing professionals, I do hear a lot of general practitioners who do prescribe. And I'm not saying that that's something that is bad in and of itself. However, what I hear a lot is that the general practitioners don't typically, I'm not saying all of them, follow up with the amount of intensity and frequency as psychiatrists or psychiatric nurse practitioners do. When we think about it, psychiatric nurse practitioners and psychiatrists do have an additional level of training where their specific focus is with regards to psychiatric help. So I do think that it is ideal to speak with one of those in order to get a proper medication and medication management. Again, I'm not saying general physicians are never someone to talk to. I would encourage you to talk to them first and foremost and see if that is something, how they medication manage, what their ultimate goal is with their treatment, and just being mindful of who you're working with and that is just something I would take away from that, is making sure that you have someone, hopefully, who is a specialist in psychiatric treatment.
And I really do actually want to take a minute to get into this specifically, the concept of physicians prescribing psychiatric medications. This is a very hot topic. I think there are a lot of different opinions here. I'm sure we might say things right now that are going to tick some people off, but I don't really care because as we've said, we're raw and unfiltered, and I'm on team clients and team advocating for yourself. So I'm just going to say this here right now. Doctors are trained generally to turn to medication as the first line of treatment. And so when you're going to a doctor who's a medical practitioner, who's trained to treat your bodily symptoms, and you tell him, hey, I'm really depressed. I lost my appetite. I'm not sleeping. I'm this, I'm that. They're going to give you a medication. A lot of the time, unfortunately, a lot of doctors do not talk to you about the side effects of these medications. They're not talking to you about your life circumstances that are putting you in this physical and mental state. They're throwing a pill in your face and saying, okay, have a nice day. And I'm not saying they're obnoxious doctors. I'm not saying that they're bad doctors. I'm just saying this is a very dangerous space and a very slippery slope, because it's such a bigger picture than that to prescribe a psychiatric medication. And we're going to say this again. We are not medical professionals. We're going to say it again and again and again. These are our professional and personal opinions. But this is something that I've seen in my private life, in my personal life, that's happened with doctors, where clients then come to us and say, I didn't know that this was an effect of this. I didn't even know why this was happening to me. I was prescribed this medication and then nobody ever followed up on it. My life circumstances changed, so I felt different, but I'm still taking this medication. I didn't know when to start. I didn't know when to stop. It becomes a very scary space. This is the reason that psychiatry is its own, section, because they have that formal training. They have that knowledge. They're talking, hopefully a good psychiatrist is talking to you first, is explaining to you, what's happening with the medication, what's happening with you, asking you, informing you. And by the way, not all psychiatrists do that either, which is
a
wrong.
lot.
Is
A
wrong.
lot don't.
If your psychiatrist is seeing you and then prescribing a medication to you within 5 minutes, find another psychiatrist, please, for the love of God. You deserve better than that. Okay? So I have to hear your thoughts on this stuff, but
I have so many rants I want to go on right now.
I'm just so passionate about this topic because I can't even explain to you the level of traumatic stories I've heard from clients because of negative situations and experiences where they went into a doctor's office, explained something psychiatry related that they were experiencing, had a pill thrown in their face and said, have a nice day, and it ended in disaster. That being said, I really want to say I have the utmost respect for medical professionals in general. They really have an honorable profession. Lord knows they're doing God's work. And I know a lot of them, even when they are being put in that situation and they are prescribing that medication, that they genuinely are trying to help you. And this is not to put down doctors. This is not to say that, shame on them. I'm saying I think that somewhere in this space, certain things got lost in translation as to how to do this appropriately. And I just think that there are better avenues to take. So I just want to be very clear that this is not to put medical professionals down, because they're incredible humans and what they're doing is amazing. But we just really have to be so careful how we get from point A to point B when we're receiving receiving a prescription for medication and then taking that medication. Where did it come from? Why are we taking it? Like, what were we informed of? It's just, there's so many pieces to that puzzle that having it being taken in that nonchalant way is very scary. Now, there are those superstar doctors, Lord bless them, that have that knowledge, that have those conversations, that talk to you about it, that then refer you to a therapist, that talk to you about the side effects. They're amazing. We love them. I'm not talking about those doctors. If you have one of those doctors, that's incredible. That is goals. Stick with that doctor. But I'm talking about the many, 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 many doctors who don't do that. But Steph,
Yeah.
please, you got to stop me because I can go on for a while. Tell me your thoughts on this.
I know it's so frustrating because I know and I do believe that, well, there's good and bad in any profession. We'll start with that. However, the majority of doctors really are doing their best, and also they are doing how they're going about their practicing how they were trained.
Yes.
And unfortunately, with that being said, too, they're working within a very broken system when it comes to insurance. That's why we're always, and I don't know about you, but anytime I'm at a doctor's, they're always super late and don't take a lot of time with you. And I'm not saying it's even their fault, but unfortunately, in order for them to make it worthwhile for them to actually make some sort of income to be able to pay their overhead, they have to book so many people in such a short window of time. And unfortunately, there's a broken system with that. But again, they're working within the framework of the medical model, and the medical model doesn't take into account mental health as much as it should.
Mhm.
And it's really frustrating with that being said. And we're also just frustrated in general because we're seeing all of the issues that are stemming out. So that's why we're kind of going on unhinged rants right now, because there is a lot of issues with that. I see a lot of people who are on medications, and a lot of times it is prescribed from a general practitioner that have been on it for years upon years upon years, and it's not that type of medication that you should be on for years upon years upon years. I see this quite a few times. And I also think that it's a good marker to have that for the majority of medications, for the majority of problems, when you are starting to take a medication, the goal is getting off of it at some point, using it as a tool. And if that's never a conversation with your prescriber, that's something I would encourage you to bring up. And if it's something that, let them explain, of course, what their perspective is, the thoughts are, but it really is something oftentimes that you want to be having a discussion, just like you and I, Rachel, when we start off treatment for the first time. One of the things that I know I talk about in my intake is getting you the heck out of therapy. As much as I enjoy working with you and all of that, my goal is for you to not need our sessions. And that is the same thing, because therapy is a tool, medication is a tool. And some people need lifelong therapy, some people need lifelong medication, but it's not the majority of the time. So please keep those things in mind.
Yeah, 100%. 100%. And I think that I'm going to say this and then we can really move on from this point because I think my, my passion around this subject
I
has
know.
expressed itself, but it's just I've just seen so many injustices happen. It's just really heartbreaking and it's just dangerous. It's very scary. I don't know if you remember, Steph, when we were interns. I think this was one of the first times I had like such a serious exposure to this. We were working with somebody who was suffering from bulimia alongside other eating disorders. And this person was prescribed a medication for, I believe, I don't know if it was for depression. I don't remember what it was for because it was so many years ago. But one of the side effects was nausea and vomiting.
Oh, right,
Remember what I'm
right.
talking about?
Like what?
We were all just sitting there like, who prescribed this to you? And it
Hmm.
was a medical professional that didn't take the time to find out the whole background, nor to explain the side effects to her.
Hmm.
We kind of like figured it out from looking it up.
Hmm.
And it was horrendous how long this child suffered until we figured this out and then needed to start an entire new cocktail of medications, which for whoever isn't familiar with that phrase, it takes a long time to get yourself comfortable on a certain regimen of medications and figure out what they call it cocktail because sometimes you have to take more than one, figure out what mix of medications is going to work together and work well for you. Wait until it has the impact, wait to see what happens. It takes time. And
Right.
when a mistake like that happens, where you already know that that's not going to be a cocktail that works, a person is just suffering and wasting time when they're already suffering. And these
Mhm.
things just make me crazy and they're completely avoidable.
Yeah.
So, just something in general, and stuff, you say this all the time, and we're saying this in our episodes all the time. Please advocate for yourselves. When someone is in therapy, also, if we're providing you with a skill, a treatment, a tool, you're getting a medication, a doctor wants to perform a procedure on you, ask all the questions. I don't
Mhm.
know how many times this happens to you, Stephanie, but like I'll go into doctors' offices and they'll be like, "Oh, there's no side effects." And I'm like, "What are you literally talking
Yeah,
about?"
you giving me water? I don't think so.
Right? There's an entire section on the pill bottle of side effects, or like, well, Steph and I make this joke all the time. Like 10 years down the road, when you see a commercial that says, if you have taken this medication and you are experiencing this, or death, please call 100. And I'm just sitting there going, like, no, like, I'm not going to be a victim. This is crazy, but it's
Yeah.
funny and it's sad because even when we ask, sometimes we don't get the answers. I can't even tell you how many times I've had doctors tell me, "Oh, there are no side effects to this," when I know for a fact there are side effects. There's no such thing as no side effects to one of these medications. It might be
Mhm.
that it's unlikely, it might be uncommon, it might be that, maybe it's not such a big deal and it's not such a bad side effect, but there's no such thing as no side effects. So
Right.
please, guys, ask the questions, stand up for yourself, take the time that you deserve with the professionals that you're talking to, because you deserve to know what is happening in your care and your line of treatment, and what you're doing with your body and your health. So
Mhm.
please, if you've taken anything from this little spiel that I've just given and that Steph has just given, just take that piece, advocate for yourself, because that's what
Yeah.
you deserve.
Right. You're your own most important advocate. And hopefully, as well, another tidbit to take away is you want to ideally not minimize the amount of tools that you're using when it comes to the medication department, if possible and when possible. Because the more that we introduce into the cocktail, then there's also more side effects, more potential interactions. So it's just something to be mindful of. Make sure, and this is something that, oh gosh, I'm trying not to go on another rant, but real quick rant is that I have seen many clients who have been on a load of different medications for different ailments. And I would ask, because there are certain things that like we could not figure out and get through. And I would ask, is there anyone overseeing all these medications? And no one. One, like the neuro doctor says, take this for this. And then you have your OBGYN saying, take this for this. And then you have a psychiatrist, take this for this. And no one is looking at the interaction for everything and making sure that there's not any negative interactions or that the symptoms that you're presenting aren't as a result of one or a combination of those medications. So I try to recommend internist doctors generally will take you as a holistic person, and there's not many of them, but they do a much better job at being able to look at you as a whole and all the medications to take a look and make sure that maybe some of the symptoms that we're presenting aren't caused by that, or if there is, how then do we move forward from there?
I also just want to bring up that, you know, deciding whether or not to take medication, it's a highly personal decision.
Mhm.
It's something to consult with, like you just said, every person that is part of your health team, your mental health team. If you're seeing a dietitian, if you're seeing an OBGYN, if you're seeing, you know, whoever's part of your team, especially if they don't know what's happening in the other person's office, you need to be that person, again, playing that advocate, that they all know what's going on in your own health. Um, but just to discuss for a second, once you're making that decision that medication is the right course of treatment for you, that this is something that is going to positively affect your life, and the pros outweigh the cons, I want to talk for a minute about shame around taking medication, especially shame around taking medication for mental health obstacles, and how the
Mhm.
shame should not exist. Now, obviously, me saying that is not going to make your shame jump out the window. But obviously that's part of something that you talk about with your therapist. But it is
Mhm.
something that I just want to acknowledge, guys. If you have a headache and you take an Advil, I hope that you don't feel shame around that, right? If you are finding yourself struggling with any type of mental health diagnoses and you're recognizing that medicine is going to play a positive role in your life and help you, just think about it from a logistical standpoint. Even though a lot of the time emotional things we know are not logistical, it's the same thing. If you
Mhm.
need a cast for your broken arm, there's no shame around a cast. You broke your arm, you need a cast to get better. If
Mhm.
you are suffering and there's a medication out there to help you, it's the same thing. And I just want you to ask yourself, like, what is creating that shame for you? If this is something that you're experiencing, where is that shame coming from? And how can you look at other parts of your life and ask yourself, why do I have shame in this space, but potentially not shame in that space? And I know a very common answer that I get from clients is, well, I should be strong enough to deal with this on my own. Guys, I think we forget that a lot of mental health disorders, there is an element of it that is the chemistry of the brain. It is
Yeah.
not about how strong you are. It is not about your willpower. It's like beyond what we are able to control sometimes, or sometimes life. There are traumas that are above and beyond what any human should ever have to experience. And that creates effects that are very serious and sometimes long lasting, life lasting, that are horrendous. And no one should have to suffer from that. If there are medications that are going to help you, you should be so proud of yourself that you're taking the steps to live a better life and doing whatever it is that you need to do to create that resilience, whether it's with medication, whether it's with therapy, whether it's with option C, all of the above, whatever it is, to help you live that life that you want.
Yeah.
Because sometimes doing nothing can be the easier route, can be the maybe less scary route, can be what you're more familiar with and more comfortable with. You making those decisions to make that therapy appointment, to take that medication, to do the work, you should be proud of yourself. And I know that that's easier said than done. That's why, if it's something you're struggling with, go talk to your therapist. But I did want to just give a minute of this episode to recognize that there is no space for shame in recognizing that you need to be taking medication, and that if anything you should really just be proud of yourself.
Yeah, we wouldn't shame. We wouldn't even think about shaming someone who's taking chemo for cancer. And that is, I know, a very extreme example, but it's one of the examples that I give to my clients because we know we would never do that. So there is a biochemistry perspective. Component of this. So, but even so, if it's something that could be helpful, it's something that you should do as long as it's coming from a personal choice of empowerment, a place of empowerment. Again, we are all about empowerment. And one of the big takeaways is just having the knowledge, having the awareness to make a decision that comes from an informed place, having informed consent. That's something that's big when we talk about in the therapy world or in any type of medical world as well. You're supposed to have informed consent, which means that you know the full risk of anything that you're doing, you know what the methods are, and just how this might affect you, and that you are still opting in for that treatment or that medication with knowing all of that. That's informed consent. So we want you to come from a place of knowledge and empowerment. And we hope that you take this episode and this session. If there's anyone that you know who is either on medication for mental health or is thinking about it or maybe really against it and they don't really understand or whatever, share it with them, because we're hoping that this can be a bigger conversation where we just realize it's not a one size fits all and there's not a good choice or a bad choice. It's just the right choice for you. And just making sure that you know where you can go to get someone who is going to properly treat you as well as manage your medication. And with that being said, Rachel, did you have anything else you wanted to wrap up with? If not, we'll go into our listener question.
Yes, I want to put out there, and Stephanie, I don't know how many times you've dealt with this. For the clients who decide on their own to stop or start a medication, my clients who are hearing this, stop doing that. You guys, it's so dangerous to
Yes.
decide on your own when to start, how to start, to take more than you're supposed to take less than you're supposed to randomly stop a medication, even to slowly stop a medication without medical guidance is so incredibly dangerous for both your physical and mental health. Please, 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 if you are in a space where you're starting or you want to stop a medication that you've been prescribed, or hopefully not, but not been prescribed,
Mhm.
please consult a medical professional first. And
Yeah.
no, a therapist, for the most part, is not a medical professional. Please consult a doctor.
Yes. Hopefully your prescribing practitioner, whoever's prescribing the medication, but sometimes they might be medication happy and maybe you don't feel comfortable for whatever reason. So if it's a medical doctor, that's really, really important. So that's such a good point to bring up. And I'm glad that you did bring that up.
Yeah.
So if you guys don't recall, we have a listener question segment at the end of each one of our sessions where we answer one of your questions as a listener. If you would like a chance to be featured in this section, please send us a message over on Instagram at Coffee and Counseling Podcast or send us an email, which is coffeeandcounselingpodcast@gmail.com. Today's listener question, I think it's such a funny one, but it's such a truthful one. Why do people act like going to therapy makes you morally superior? I have thoughts.
I want to hear the thoughts.
Okay. It's interesting because I think at this point in time, we view therapy, again, this, we kind of talked about this in our last session, where we have an overcorrection where we went from never talking about mental health or even acknowledging that it exists to everything is about mental health, protecting our mental health, and that is the be all and end all. And I think that this is a symptom of that overcorrection where it is almost as though it's a social currency right now, which is I'm going to therapy. Somehow that makes me more of an evolved human being because I go to therapy and I've learned, I've done all the challenges, and it's almost another way to project onto others what the work that you might have done, and maybe it's a way to validate oneself without actually. It sounds like there's probably something else that needs to be worked on within that framework. Therapy is not the only way to grow, just like medication is not the only tool in the toolbox. Sometimes it's necessary. Therapy is sometimes necessary. However, it is a tool. And sometimes we don't, sometimes we use different tools and we could still get the same result. So it's great if you decide that therapy is a tool for you and you pursue it. But if it's not a tool for you, then that's fine too. And we need to leave space for those people as well. One option, I'll stop with this. One option is not morally superior to another. So Rachel, did you want to add to it, or did that answer your side as well?
No, honestly, you answered my side as well. It's so funny the way that this question was phrased because I never thought about it this way, but like this is such a thing where it's
Mm-hmm.
like, oh, my therapist said, and I go to therapy.
Yes.
Listen, I think there is a confidence that comes with having this newfound insight of yourself and understanding of the world and how you relate to the world. And I think that that's great. Having that healthy confidence of like knowing who you are and knowing your place in the world and understanding your pros and cons when it becomes like, oh, I always say to my clients, just because I sit in this seat, it's not like I understand the world better than you or that I understand you better than you, right? And so I think it's the same thing for the clients. It's like now that you have this newfound psychoeducation, self-awareness, insight understanding, it's amazing. And you do have this brand new wealth of knowledge and toolbox, but it doesn't make you morally superior to another human being.
Totally. And yeah, I thought it was a funny way to phrase it. And I was excited to answer this question. All right, everyone. So we want to hear from you. Another reflection question that we have, we try to throw in at the end of our sessions, is what is your experience with / thoughts on medication and mental health? We really want to open up this conversation, and there's not a right or wrong answer. We want to hear your perspective so you can share it. Again, over on our Instagram at Coffee and Counseling Podcast, or email it over at coffeeandcounselingpodcast@gmail.com. Everything, all the ways to contact us, links to our sites is in the show notes. If you wanted to work with one of us, our contact information is in the show notes as well. Everything will be there and is always there. And we really appreciate you joining us today. And we hope that you'll tune back again next Tuesday for our next session.
Have a great week, guys.
Thank you so much for being with us today. Please follow our Instagram at Coffee and Counseling Podcast and send any questions you have about any topic to us via direct message for a chance for your question to be featured in one of our next sessions. You can also email us your questions or topic suggestions at coffeeandcounselingpodcast@gmail.com. Make sure to check out some of our other sessions available to you right now. Once you drink up all of those and your coffee, come back next Tuesday for our next session.
The information shared in this podcast is for educational and informational purposes only and does not constitute therapy or mental health advice. Listening to this podcast does not establish a therapeutic relationship between you and the hosts. If you are in need of support, we encourage you to seek help from a qualified mental health professional. This podcast is not a substitute for individualized care. We do offer individualized therapy. If you're interested in individual therapy with one of us, please visit our practice websites and send us an email to set up a free consultation call. All of the links and our contact info will be in the show notes.